you, Sally. And I just want to say thank you to the organisers for the invitation to speak at the first UK COVID conference. You know, the COVID Coronavirus Act of 2020, it just ripped our rights to bits. But it also literally threw us under the bus because we didn't have the right to life, according to this government. We were just literally disposable. And I think it's really important as well, because mental health isn't covered an awful lot, that under the Act, if you were in crisis and needed section, they took away the right for an ASW and a doctor to actually carry out a section. And that was reduced to either one doctor or a social worker. But it is the appalling powers that decided who lived and who died. It was literally Russian roulette during the pandemic. And, you know, a month, and also the lack of information for disabled people like me, clinically extremely vulnerable, couldn't get hold of your doctor, couldn't get hold of your consultant, you were just cast adrift. And all of the government announcements with no British Sign Language interpreters, lack of accessible information. And for many disabled people, and this is still the continuation today, what we saw during the pandemic, and actually it has to say before the pandemic, but it was ramped up, the tens of thousands of DNRs placed on disabled people's records without consent of them or their families. Especially if you had a learning disability, you were 30 times more likely to die if you were in the 18 to 30 age group than that of non-disabled people in the same age group. And I'm in sheltered accommodation, and I have to say that, you know, when the pandemic had started and, you know, we were on lockdown, you had no warden. Our next door neighbour was 100. She had no one. We were ordering, thankfully we had access to the internet. We were ordering food online to try, because you could not get online shopping orders or online delivery slots. And the supermarkets actually doubled their online delivery charges during the pandemic to make a profit. And for many disabled people in receipt of benefits, if you haven't got £2, those online delivery charges become then unaffordable. And even now with the cost of living crisis, disabled people today are going hungry. But what we saw with the NHS, you know, we've seen that the government have used the pandemic now as a way to cut NHS services, lack of access to GP appointments, replacing GPs with physician associates with 2 years of training, the removal of long COVID clinics, the lack of masking in hospital settings and in primary care settings. And also I have to say carers not actually wearing masks when you're having, you need social care. But also it has to be said with the current government, it's absolutely appalling that the government have reneged on introducing a social care cap. We've got 100,000 disabled people in social care debt. 1 in 3 disabled people cannot afford social care and are going without. This is causing mass inequality, and we need to push for fully funded social care, free at the point of need, paid for by progressive taxation. And that needs to be a demand, and we mustn't let Labour off the hook on this. But also, I think it's absolutely appalling that, you know, we know the pandemic hasn't gone. COVID is very real, and it's had a detrimental impact on our lives. And there is still mass confusion in public services when long COVID is still classed as a disability, and it's a relatively new condition. Well, under Section 3 of the Equalities Act, you know, if you, by law, a disability is a physical or mental impairment that has a long-term and substantial adverse effect on a person's ability to do normal day-to-day activities. Long COVID does that. It impacts on your day-to-day functioning. Some days are better than others. Well, that's a disability classed under the Act. And when so many disabled people have been turned down for personal independence payments, or told you know you have to commit to work searches and everything, it's really, really important that we know what our rights are and access that support. But also the pandemic has also cut many welfare rights services. But I think it's really important to add this, that during the pandemic, there were over a third of disabled people. There's 16 million disabled people, and a third of them had no access to broadband or access to the internet, and
Paula,
were cast. I just wrap up. And have no access to the internet and were cast adrift. For me, if I didn't have access to Facebook or WhatsApp, I would have been in a very different situation in the pandemic, because I used all of these to make call outs for medication, for support for food, and we supported each other. But also, I think what is so important, that we mustn't let the government off the hook regarding the coronavirus pandemic inquiry, that many of us have been denied access to actually give evidence, and many groups were not given category 4 status, DPAC being one of them. But also I want to say this, that, you know, I lost my aunt on the 21st of July, who died in hospital contracting coronavirus in a nursing setting, who had MS. She died 2 days after my birthday. But also on that day, I lost my mental health support during the pandemic. What we've seen in mental health is a two-tier system, that now many people in mental distress are having to pay for low-cost therapy. But now we're seeing low-cost therapy withdrawn. What we need to do going forwards is we need to demand masking is brought back into the wider public on public transport, our hospital settings. Also, we need to demand cleaner air in our workspaces, we also and wider society. But also, one last thing, that the government are planning to bring massive changes to the benefit system and push disabled people into work. We need a mass mobilisation against the austerity budget on the 30th of October, and we need to campaign all the harder to make sure that disabled people get the access needs and also get the support they're entitled to. Thank you very much for having me speak to you all today.